Have you noticed that when you remove your underwear or you're going to the washroom that you're leaving a stain on your underwear that looks like feces? So a poo streak, a skid mark, there's lots of different names that people will use for this. I want to help you understand why this might be happening, but more importantly, what you can do about it, because it's really quite horrible to know that you're leaking. And the truth is, you shouldn't leak at all. Nobody should leak. I should be able to give you the information and the tools that you need in order to take the next steps to stop this from happening. I'm sorry that it's happening now, but I'm very glad that you're here because I have some really cool information for you. So who am I? My name's Kristen Norwick. I am a pelvic physiotherapist. I have a master's degree in physiotherapy, and I have extensive additional training in pelvic health. So that's knowing how your pelvis works and the muscles in the area, which includes bladder, bowel, and sexual function. So bowel health is involved in what's going on with the poo streaks. First of all, I want to give you an overview of what your pelvic muscles are, just so you know where they are in your body and why they're relevant to this topic. So here's my pelvic model. Your pubic bone is at the front, your lower back ends at your sacrum, and then your tailbone. If you look from below, this is the opening of your anus, and these are your two sit bones. And then your genitalia will be here. These pelvic floor muscles need to work properly in order for you to have optimal bowel function. So when you go to empty your bowels and you sit on the toilet, you should relax your pelvic floor, and that should allow your bowel movements to pass through. And then when you're living your life, doing your thing, you should be able to have enough strength in your pelvic floor so that there is no leakage of feces. And so if there is leakage of feces, we know that there could be something going on with your muscles specifically, and how good they are at doing their job of stopping leakage from happening. So what is a poo streak? What is a skid mark on your underwear? What does that mean? Generally, if you're pretty confident that that is feces, poop, or something coming from your anus, that's generally an indication that you're experiencing leakage of your feces. And so you might think, well, I'm not pooing my pants, like it's not like a full bowel movement, but there is a little bit that's seeping out. That's still considered leakage because ideally, if everything's working as it should be, there shouldn't be any leakage out of your anus when you're not actually sitting on the toilet emptying your bowel. And so I don't say this for you to get worried about it. I say this so that you can feel empowered to know, okay, this is what's going on, and there are treatments and there are solutions and avenues you can take to actually fix it. So you don't need to just cope with it. You can actually do something to fix it, which I think is a really, really great thing to know if you're experiencing it. Before I get into how your muscles are potentially involved in this, I just want to note that in a case where you are leaking feces, it is a good idea to chat with your primary care provider, so usually that'll be your family doctor, and just ask if they think that you need a referral to anyone or if they want to do any further investigations. If you're in an area where you require a referral from your doctor to see a pelvic physiotherapist, you should definitely ask for that, because your pelvic physiotherapist that you can then go see can help you learn how to use your muscles and see if that helps or gets rid of the leakage. There are two major reasons why your pelvic floor muscles might be involved in this leakage. So the first one is actually that your pelvic floor muscles aren't really good at relaxing when you're trying to empty your bowel. So when you sit on your toilet, your pelvic floor muscles should relax and open. And what that does is it actually opens your anus. You've got two anuses actually, and it unhooks one of the muscles, it loosens one of the muscles to allow your bowel movement to pass through. If your pelvic floor muscles relax and open super well, you're more likely to completely empty your bowel movement. And if your bowel movement completely empties, there shouldn't be any residual feces left in that lower part of your bowel. So let me show you my little rectum here. So if I open this up, so this is the end of your bowel, so this would be where your anus is, and if you open it up, you can see it's a cavity that can hold feces. So this is important because when you don't want to go, your feces can stay there for a little bit until you can make it to the toilet. However, if you empty and you think, okay, I fully went to the washroom, and there's anything residual stuck in here because maybe your muscles didn't fully relax, and that residual, it could be liquidy, it could be mucus, it could be any number of consistencies that gets kind of left here. That residual can potentially leak out throughout your day when you're walking, sitting, working, running, exercising. It can seep out over the course of the day. So that's the first thing. Your muscles might not be fully relaxing and you might not be completely emptying. The second thing could be that maybe you are completely emptying, but then as your bowel movement is passing throughout the day, maybe before you're able to make it to the washroom, you are trying to hold your bowel from emptying, but your muscles aren't strong enough to do that. So there could be some muscle weakness involved. So the sphincters that hold the bowel tight and cinched when you're doing things, those sphincters, and then the one other muscle called your puborectalis, which loops around and also keeps your bowels tight and closed, those might not actually be strong enough or might not be working in the most functional way. And they might be a little bit relaxed and they might allow some passage of feces to occur. So there could be muscle weakness as well. In order to know if you have tightness and you're not emptying completely, or if you have weakness, the best thing that you can do is see a pelvic physiotherapist who can assess you for this to tell you how you can optimize your muscle function. Okay, now that we talked about causes, let's talk about what you can do about it. In order to ensure you're completely emptying your bowels, there are a few different things that you can do. If you feel like it tends to be difficult to empty your bowels, or if you have irritable bowel, like sometimes it's more firm, sometimes it's more loose, that can be a sign that your pelvic floor muscles aren't relaxing fully, and it could be a sign that you need to modify your diet a little bit. The first thing that you can do is put yourself in an optimal position to relax your pelvic floor when you're trying to empty your bowels. And this optimal position is being in a squat position. So if you have an upright toilet, then getting a footstool like a squatty potty that you can place under your feet, round your back and get more into that squat position, that allows your pelvic floor muscles to just automatically relax a little bit more. That could be the only tip that you need in order to start fully emptying. And then of course the second thing is to learn how to relax those muscles even more. And so you can do this by learning how to move your muscles down. Imagine you're opening them, opening your anus as you're trying to empty your bowels. And it's often helpful for you to take a nice big deep inhale to really expand through your pelvic floor. And if you want more time to practice that and learn how to do that, you can check out this pelvic floor yoga video where I teach you how to really relax your pelvic floor in different positions. The other thing that you can do is optimize your diet to allow your bowel movements to be able to pass more smoothly. So a few tips that I can share with you as a physiotherapist are, you can increase your fiber and also increase your water intake. It's usually best to do that at the same time. You could try out chia seed pudding, which actually allows your bowel movements to be bulkier in a good way and a little bit smoother. The other thing that sometimes helps is prunes or prune juice. And what those can do is they can actually create more rhythmic beating of your bowel, of your gut, to allow your bowel movement to pass through more smoothly. Of course, those three things may or may not be appropriate for you, so definitely check with your care provider about that. And if you want more details on diet, you could see someone who is an expert on diet, so a dietitian, nutritionist, etc. If you feel like you've targeted that ability to completely empty and things are going smoothly there, then you may want to start to learn how to strengthen your pelvic floor muscles if that's what's going on for you, so they can be stronger throughout the day when you're not wanting to empty your bowel. This ideally is done in a one-on-one setting with a physiotherapist. So you can see a physiotherapist online or in person with expertise in pelvic health who can teach you how to optimize your muscle function. Unfortunately, this is something that's really, really hard for you to learn on your own. However, if you are uncertain if you can afford physiotherapy or if it's an option that actually will work for you, don't hesitate to just book one of our free 15-minute consultations. You can speak with one of the physiotherapists and find out if there is any way that we can make it work for you. And then the final thing that might just be the easy fix that you need is there's a chance that that poo streak you're seeing actually isn't leakage. It actually could just be residual feces that you didn't fully clean off when you did empty your bowel. And sometimes this can happen if your anus has a bit more folding, so things can get stuck a little bit easier. Maybe you have hair that can trap some of the feces. So I think maybe this is the first step you should try really cleaning super well. So you might need a moist cloth. You might want to try a bidet. You may want to try out a few things to make sure you're actually fully cleaning yourself properly. And this is not only good just so you're not having those streaks occur on your underwear, but it's also healthier for your pelvic floor muscles. If feces is allowed to sit on the skin, then actually that can make the pelvic floor muscles a little bit irritated and a little bit more prone to not quite functioning exactly how we want them to. Cleaning is both nice, but also helpful for your body. Okay, so those are all of the major reasons why you might be experiencing the poo streak on your underwear and solutions that you can explore. If you have any other questions, don't hesitate to write them in the comments. And like I mentioned earlier, don't hesitate to book a free 15-minute consultation with one of our physiotherapists. We can see you online and help answer any questions you have and figure out how you might be able to work with a pelvic physiotherapist. Thanks for watching and good luck.